official statistics that show the coronavirus toll by demographic, but in some communities, the pandemic appears to be disproportionately affecting people of color. Our national correspondent, Jerika Duncan, has been looking into this. Jerika, good morning. We heard David Begnaud report earlier today that he observed mostly black men in the ICU in the hospital where he was. Very interesting finding there. What have you found?
Well, it's no secret, Tony, that African Americans have a higher rate of things like diabetes, asthma, hypertension, those underlying conditions that we talked about that have led to the deaths of people with coronavirus. And because of that, one local health commissioner who calls racism a public health issue says she's collecting important information that she says could help save lives.
We're in the middle of the storm right now. We need as much data as possible. Right now, we're flying blind.
Milwaukee Health Commissioner Jeanette Kowalik is overseeing roughly 1 million residents in Milwaukee County.
Of the 40 people who have died so far because of the coronavirus in your county, what percentage of those people are Black?
Right now, it's still about 80%.
African Americans make up 26% of the population?
Correct.
Right now, the CDC is not collecting data on the race of those who've tested positive or died from coronavirus.
It's important to actually document the race of the people who are infected and dying.
Everyone will be affected by this, but there are some communities and populations that are going to be affected even more significantly.
Dr. Uche Blackstock is founder and CEO of Advancing Health Equity in New York City.
The reason why we need to really discuss this issue and to collect the racial and ethnic demographic data on who is tested, who has the disease, and on who's dying from it is so that we can properly allocate healthcare resources equitably to the communities that need it.
Dr. Blackstock also works part-time at urgent care facilities in Brooklyn.
Can you describe the makeup of the people in your waiting room right now?
We're noticing more Black and brown and immigrant patients that are seeking care. And a lot of these patients are essential workers. A lot of them are service workers.
She says testing is still not readily available.
How many COVID-19 tests are you all able to give each day?
We are instructed that we probably should not test more than 1 in 10 patients.
So 10%, exactly. No more than 10% of the people that come through there every day.
Our criteria is really, we're focusing on the highest risk patients.
CBS News contributor Ibram X. Kendi is also director of the Anti-Racist Policy Center at American University.
If we don't have an awareness right now of racial disparities, we can't right now figure out what's causing those racial disparities. What policies or even lack thereof, and we can't change it right now in the moment when people are dying and being infected. And
according to a new report by WBEZ Public Radio in Chicago, an analysis of the county found that 70% of people in Chicago who have passed away because of coronavirus are Black. And you're talking about nearly 300 deaths right now in the whole state of Illinois because of coronavirus. But definitely important information when you look at how we track other diseases, other viruses, and this being a pandemic. I'm sure there are a lot of people that are hungry for that information right now.
I'll say, Jerika, this is such an important story. We've heard this saying all the time, knowledge is power, and all of your experts seem to say that you need more information to know exactly what you're dealing with and how we need to fight it. So glad that you are raising this issue.
Good evening, everybody. Well, it's Thursday, July 9th. Happy birthday to anybody who's celebrating a birthday today or this week or this month. I'm a July baby, so I'm celebrating the entire month of July. Those who know me, love me, and are close to me know that about me. But we do have a special guest tonight. I'm so excited to be talking to Dana Ballinger tonight, all the way from St. Louis, Missouri. She is our guest, and it's just Dana and I tonight. Dana is a data specialist. She's got a few other hats that she wears, and I'll talk about in a minute, but because she does so much around data, I really felt tonight was a night that we really needed to discuss what the data is showing and what to anticipate moving forward. Those who joined us on Tuesday, you got a chance to kind of get a great overview about how the coronavirus is affecting the Black community. But tonight, now we're looking at the numbers, and now we want to see how we can best position ourselves as the Black community with all the numbers that are out there. So just give me a few minutes to kind of introduce Dana and kind of talk a little bit about her work. I want Dana to kind of share some of the things that her organization is also working on. Dana, you do serve as the Director of Care Coordination and Population Health for Christian Hospital in St. Louis, Missouri, a title, right, that I have never heard before. And I think it's so interesting that we have specialists and gurus and experts like yourself in these great positions that many of us never really get a chance to hear about. So, Dana, I want you to take a few minutes to talk about kind of what led you to this work as this Director of Care Coordination, Population Health in Christian Hospital, and then what initiatives maybe your organization is working on. And then after that, I want to kind of jump right into the data.
Okay. Well, good evening, everybody. My name is Dana Ballinger, and I am the Director of Care Coordination and Population Health at Christian Hospital. I've been with Christian probably about 12 years now, and just to level set, we are less than 10 miles from Ferguson. We are here in North St. Louis County. This is my home. I live about 4 miles from the hospital. And I come to you today just to share with you some data surrounding how COVID has impacted our community here in St. Louis. So I am excited to share what I know, excited to hear from you and learn from you, and just kind of have some authentic conversation around how we can impact our community collectively, how we can start to educate and empower our community to take care of themselves, and what we can do to impact the health disparities that exist in our community. I think that's a huge, huge factor that plays into what we do. And so part of what I do is I assist patients and families with care transitions. So I have a team of people that I work with that really pay close attention to what those disparities or barriers that are keeping people from being healthy and being well. And so I am responsible for a strategic framework for post-hospital discharges, looking at the community in a broader sense from a population health perspective, and understanding what that really means and how we can apply interventions to impact our community here. So.
Yeah, I appreciate that, Dana. And I know I want to jump into the data here in a second, but just again, I'm just thoroughly excited, not just to have you on the call tonight, because we see so much by television, by the internet, and we're just in a position now we don't even know what to believe.
Sure.
They talk about a vaccine, they talk about it'll be lifted, they talk about, all of these things to expect and anticipate, but it's starting to spike again. And I think this is the season where we thought it wasn't. And so now we're just kind of in disbelief. So I want to pull up some of the data, and I want you to kind of walk us through some of these findings that you have been really looking at very closely, and then what we should think about and anticipate moving forward.
Sure. And so just to give you all a little background about what I do day to day. I work very closely with case managers and social workers, and our role is to really connect with our patients. We hear statistics about the number of people on the ventilator or how many hospital admissions, but our role is to really get to know those patients. What we're finding when we see our patients, their stories are amazing. Unfortunately, we have husbands and wives that come in together. We have multi-families that cousins and relatives that are impacted. And so part of what I do is really work closely with our data analysts. And I have to send a shout out to Aaron Valroy, because he has been phenomenal to work with as we start to look at the data here in St. Louis and learn more about what we know about this horrible pandemic and this bad virus that we're facing. And so what I want to do right now is just level set a little bit of information and background. So as you can see here, we have a legend. We have a map of St. Louis. What you see in the darker purple areas, so the darker the purple area, the more COVID cases there are. And so just at first glance, you can very easily see how North St. Louis County has been impacted. That red arrow there is where I live. That is Christian Hospital. And I live probably about 4 miles from that area. But what you see surrounding Christian are the number of COVID cases. Initially, when COVID first started, we beat out everybody in terms of prevalence and the high rates, and we'll get into that in a bit. But I just wanted to show you that North St. Louis County is what's in the darker purple. And then as you move throughout St. Louis and surrounding areas, the lighter purple colors are those colors that are in more suburban, South St. Louis, more affluent in some cases. These areas are predominantly white areas. But what we know is up north, that's where we have a high population of African American communities that struggle with health disparities such as transportation, housing, financial resource strain. There are a plethora of issues. On top of the fact that the highest zip code that we have observed over several years is 63136. 63136 is a large area, and it includes some of Ferguson, Jennings, Delwood. There are a lot of areas that are encompassed and municipalities that are encompassed in that area. But we also know that it is a high population of individuals that struggle with health disparities. And so I just wanted to take the time to level set kind of what we're looking at and kind of set the tone for what we'll be talking about. So as we move through these slides, please pay close attention to that 63136 zip code as we move forward through the slides.
And as Dana has framed that particular zip code, I want everyone who's watching who may not be from the St. Louis area, I do not live there, but it's just very interesting to hear about the areas that are densely populated with African Americans and how high those numbers are. So think about where you live and how those areas may be very similar to some of the data that Dana is showing tonight.
Yeah. This was another very interesting slide, and Aaron and I talk about these types of slides all the time. We have been looking at zip codes and health disparities surrounding race for years. This isn't anything that arrived with COVID. And so what was interesting is that we could anticipate what zip codes were going to be impacted, just simply because when we look at our emergency room visits, when we looked at our readmission rates, the same zip codes always came up time and time again. And so we knew what zip codes were probably going to be impacted. We were hopeful that that wasn't going to happen, but unfortunately it rang true with COVID. So what we're looking at here is the total number of cases, and I was just able to pull this today, but it was the total number of cases in St. Louis. So About 7,469 cases. New cases in the last 24 hours are about 185, which we've seen where numbers could be much higher than that. But if you look at the cases over time, so the coronavirus cases, as they accumulate from month to month, and then you also look at the daily new cases, look at that trajectory and how quickly those numbers went up, and they continue to go up. So if you take a look at population by sex, our females seem to be more COVID positive than our males, and wanting to better understand that a little bit. Mm-hmm. But check out the race and ethnicity. The green bar graph is our African American community. The purple bar graph is our mixed population, so 2 or more races. And then if we take a look and compare it to our white counterparts in blue, we can see just by this bar graph the rate and how quickly and how rampant these cases are impacting our community. You move over to the Asian population in orange, and then there are all other races. So there are instances where we have patients or we have folks that present and they don't want to disclose what race they are, so they're kind of in the other bucket. And then we have Hispanics, which is in that red color, and then the non-Hispanics. So not really sure what that definition is, but I just wanted you to pay attention to the African American population by race and ethnicity, and just compare that across the board. It's just astounding. And we'll get to look at some other data specific to our hospital in a bit. But
Dana, really quick, I'm curious about the population by sex. It shows more women than men. And I think you alluded to, you're still trying to figure out the reasons behind of that. Talk to me about maybe what you guesstimate. I'm wondering is it because more women are being tested than men, or do you think it's something totally different?
Well, that's a good question, and it would take us getting into the data to really understand. Now, I will share that when we see our patients come to visit us, we see a lot of frontline workers. We see individuals that work in healthcare, whether they are certified nurse assistants, they could be nurses. They could be frontline occupations working in food service and different things like that. And so we also know that women are more often ready for healthcare than men, so to speak. Men aren't excited about healthcare and going to get tested and going to the doctor as much as women are. So it could be that there are more women showing up. We just don't know, but it'll be interesting as we start to look more at the data to see what we find. And so this next slide, I really want to reiterate that zip code, right? So what you see in purple is 63136. And that zip code, as we look at additional data, when we think about how that zip code has been impacted, the number of new cases that we're seeing, that 63136 zip code is super, super powerful. And I also want to share that in population health, in public health, we're always looking at data, and we're always looking at zip codes where people work, live, and play. And so it's super important that when we're looking at the data, that we quickly understand how our population, how our communities are impacted. And again, this just speaks to the fact that those high-risk zip codes that we've been looking at all along are heavily being impacted by COVID-19. So this is this next slide again is just a different vantage point, but this is by month, and look at how quickly that trajectory happened. So when we look at March, when we first had COVID-19, and how quickly this virus has impacted our African American communities, it's just astounding to sit back and constantly look at how much these zip codes have impacted us as a community.
Dana, talk to me for a second. 63136 is I think you and I discussed earlier, is heavily populated. It's the Black community. But I'm curious, the gold and then the brown, which is not too far from the purple. Talk about those communities for a second.
And so in geography, they're not far from each other. So 63136 and 63033 own about 20% of those cases. And literally in St. Louis, North County, you can drive 5 miles down the road and end up in a different zip code. All three of those zip codes are very close to each other. So you have 63136, which is like Ferguson, Delwood, those areas, and then 63033 is our fluorescent area. And we have a lot of our population that come to us, and they're probably no more than 5 minutes from each other. So those areas are very, very close to each other. Now this next slide, again, just reiterates the comparison between our Black communities and our white communities. Take a look at the difference in the disparities and how COVID has impacted our communities of color. The orange is definitely depicting our Black or African American communities, and the white line there depicts our admissions based on our white counterparts.
Then I do appreciate you just showing the data, right there in St. Louis where you are. Can you just talk for a few minutes about how you think this data extends beyond just St. Louis, right? Let's talk about the nation for a second.
Yeah. So I hear over and over when I'm watching cable news disparities, and you really don't realize the impact until you see the patients. And I almost bet that if we pick this data up and we change the name to DC, or to Texas, Houston, or if we changed the name of the state to New York City, chances are we're probably going to see very similar information and data. And so I would encourage those on the call to go back to your home state and start looking at your health department data and just better understand how is our community being impacted, and what can we do, right? So how can we at least arm our community and prepare them for this pandemic, and how we can prepare them to move forward.
Yeah. A question that I wanted to ask on Tuesday, I didn't really get a chance to get to it when we had our other guests, Dana, that I hope you're able to shed some light on. There seems to be a lot of variation across states. You were just talking about how St. Louis may be very indicative of how the rest of the nation looks, specifically in the Black community.
Mm-hmm.
There seems to be a lot of variation across states in terms of how they report the data that makes comparing data across states extremely hard. Mm-hmm. The data may actually undercount the disparity observed in communities of color because they're not getting tested, right? Do you find this to be true in the area where you are?
Well, I think testing in general has been a challenge. There just simply isn't enough tests. I can remember when we first started down this path, Christian Hospital actually had an on-site testing site. We had a tent here where those of the community could actually drive up and be tested, which I thought was a great concept. The issue is that it was a challenge to get tested. You had to go through all types of questions, and if you recall, initially it was only if you traveled internationally. Well, naturally, our communities, not everyone travels internationally, so it was really a challenge, and it continues to be a challenge to get tested. Now, as mentioned on Tuesday, our health centers have really stepped up, and they are offering testing. Our public health department is offering testing. And so as we start to move down this path, we're starting to see more availability in terms of finding a location to be tested, but it still is a challenge in terms of meeting the criteria to be tested. And I think that just continues to be a barrier in this space.
Yeah. If you're joining us and you want to make a comment or ask a question, we do want to reserve some time at the end for Dana to take some questions from our live audience tonight. Dana, and I'm quoting you mentioned this earlier, that we have a higher concentration of frontline workers, multi-generational households, which is embedded in our culture, so there isn't as great of an opportunity to social distance. You mentioned that we don't have the best access to primary care, access to affordable health care coverage, transportation, along with high prevalence of chronic health conditions, some of which we talked about the other day. Black Americans are placed in high-risk positions due to being frontline workers. Jobs aren't changing, and the inability to social distance is more prevalent. So, Dana, what can we do, right? If the jobs aren't changing because many of our community is frontline workers, and you talked at one point about housing and the inability to social distance, that kind of leaves us in a very precarious situation. So what can we do about those two factors?
Well, one of the things that I was very empowered by is that once we realize that our communities are in fact being impacted, because there was a perception out there that Black people don't get COVID, and it took a while for people to catch on. And I think that we are, at least here at Christian, we are blessed to have our hospital president. He is African American, and he is heavily engaged in our communities. And he has been out there really advocating for ways for us to stay safe. And I think if we have appropriate access to PPE, that's the best that we can do for now. Making sure that our community is prepared with masks, making sure that we are social distancing when we can. Obviously, there isn't a lot that we can do for those in multi-generational families that live in one space. But early on, which I thought was amazing, we actually had a hotel that was converted to allow those that lived in multi-generational or multi-person households to actually go to that hotel and discharged to quarantine. And there was no charge. It was ran by the National Guard. And I thought that was one way that we could really help with that social distancing issue for those that have multiple people that live in the same house, because it allowed for those folks to go to a safe place and continue to be monitored by healthcare professionals and maintain that social distancing. But I think that as we start to embrace for a second wave here in St. Louis, it's all the more imperative that our communities receive adequate PPE that they need.
Yeah, a second wave where you are, and a second wave across the country, right? I think that we're all about to experience this in totally different ways. There have been talks of, schools now going hybrid in the fall, some in person, some online, and other schools who are saying, you know what, we're not even going to put our students in that situation. We're going to go completely online. Which I think is important. If you could talk just for a second about the hotel piece, I thought that was very, very interesting. I'm in Washington, D.C. I haven't heard about that even out here. Was there some sort of litigation someone was fighting for? Were there enough residents who were put in a petition to congressmen and congresswomen? Like, how did that come to pass? And is there ways in which our listeners can do that in their own cities to maybe help prepare themselves if they do live in a generational complex?
Sure. So what we quickly found was that we had these patients coming to us that we were having to send back home. Now, 3 of our major health systems came together. So we have 3 major health systems here in St. Louis, and they all came together and developed a task force. And they realized quickly that it was time for us to come up with a plan for those that live in multi-family households. And so we were blessed to have all 3 of those health systems kind of collaborate together and identify a site, which was here in North County. It was just down the road from us, and actually Christian Hospital was responsible for a lot of those patients going there. Once the numbers started to move down, once the civil unrest and the killing of George Floyd happened, our team there on site had to make some tough decisions and figure out what to do next. There was also at that time a huge influx of COVID cases in nursing homes. And with the National Guard operating the hotel, they were pulled in multiple directions. And so between the killing of George Floyd and the rampant number of cases in the nursing homes, they just had to make some tough decisions. But we're hopeful that we'll be able to revisit that again in the event that we have another surge.
Yeah, and in the event, I mean, we might as well already start preparing for that. And I think that's one of the things that the Black community, we need to do a better job in understanding that this thing is not going away anytime soon. There was a comment in the chat, and I want to kind of bring it up because it was actually in one of your slides, that when this virus first came out, it was thought that it affected just the elderly, right? And now we're finding that I think the age range you showed in one of your slides was 25 to 40 or 25 to 44. Correct me on those numbers, but that seems to be the highest group of individuals who are African American who are catching the virus. Is that right?
That is correct. In fact, we're starting to see a shift in our age group. We're starting to see that number 20 to 25, 20 to 40 really start to skyrocket, which is concerning, because that means that our younger population is starting to show symptoms. We have our younger population that also struggle with health disparities as well, such as diabetes and hypertension. Some of our younger population are on dialysis. Some of our younger population don't have access to affordable health care. And so we're really starting to become more and more nervous as we start to see a change and a shift in this data as it relates to our younger population.
Yeah. Another comment from the chat box. one of our listeners was asking about the vaccine. And we've talked a little bit of, well, we at least listened to this vaccine that's supposed to come out. And I even have heard now, Dana, that the first vaccine is not going to necessarily be the right vaccine. They'll probably have to do it a few times before it becomes the right one. But do you think that the Black community specifically will struggle in taking the vaccine when it comes out, signing up for it? And in that same question, what about access to the vaccine itself, right? What about folks in the community who don't have a primary care doctor? Will that vaccine be available to even those who don't have a primary care doctor?
You know, that's a very good question. And I know, Jason, that you sent me that question earlier. And so I reached out to a couple of our physicians here, and their response to me was, you know, Dana, we just don't know when we're going to get a great vaccine. We just don't know how effective it's going to be initially. And they weren't very optimistic. You know, just simply because these types of things you can't rush through. You know, it could be very detrimental if we do it wrong because we're doing it fast. You know, and so they are very cautious. Our physicians are very cautious at even the discussion around vaccine because we're still learning so much about this virus. And there are so many things that are popping up. So one example that I can share with you is, you know, we all heard initially, if you have a cough, shortness of breath, chills, body aches, high fever, we were starting to see patients that didn't have any of those things. And as our physicians started to do more and more testing, later on in the course of their illness here, they started to see the symptoms. But initially, they didn't show up as the basic symptoms that we all know about. And so they're still learning a lot about this virus. And I pray that we do it and that we do it right, so that we don't have some pretty bad outcomes in the end.
Yeah. And I don't think we talk enough about this topic, Dana. We discussed it on Tuesday, and we're discussing it again tonight. And I want to continue to discuss it, you know, moving forward, because I don't think that the nation as a whole has taken COVID-19 very seriously, and certainly not the Black community need to really take it more seriously. You mentioned earlier something about a partnership, and I want to kind of jump into that conversation a little bit, because we've seen so many different entities and organizations who are on the front lines and trying to get ahead of this pandemic. But I have found that there are communities and organizations quite like yours who are partnering. I read your hospital partnered with Salvation Army to address these community health challenges and also the social determinants of health that has led to poor health outcomes, especially for Black Americans. We continue to address this problem, but I hear very little, Dana, about the actions and the outcomes of those actions, right? So there's the problem, there's the partnerships, but then the news stops. We don't hear anything about what these partnerships are doing and then the outcomes. Can you speak to some of the action and outcomes that you're privy to with your partnership with Salvation Army?
Sure. So we, first off, going back just a bit to that question of vaccine, you know, we rightfully so have not had the greatest history in terms of trusting the healthcare system because of experiences that we have encountered as an African American community. So when it comes to the level of trust with healthcare, that's pretty tough. You know, flu vaccines. You know, every year we have a health fair and we encourage flu vaccines, and not everyone is really trusting those vaccines. You know, as long as the flu's been around and flu vaccines, there's still a question about the validity of certain vaccines. So I appreciate your question about, even if we had one today, will others really trust the process and trust the system? And unfortunately, that's the reality based on our past experiences. So
yeah, and just as you were saying that, Dana, a comment and then a question came from our audience. In one of the guests' community, they offered free testing clinics to African Americans due to their high risk, but unfortunately, it was not successful. And the guest said they spoke to some individuals as to why they're not willing to do the testing. And to your point, Dana, they commented that they didn't want to be guinea pigs or part of another Tuskegee experience, right? And so from your post, your seat, your position, how can the Black community overcome that concern? It's such a real concern. You mentioned it with past vaccines. We see it right here in our own community who don't want to be test dummies or guinea pigs or part of an experiment, right? How can we overcome that?
Well, I think a lot of it is rebuilding those trusting relationships with our communities. And what we identified was our community that struggled with paying their rent, struggled with housing and affordable health care. Those individuals were seeking help from Salvation Army. And they were the same individuals that were coming to our emergency rooms for help. They were trying to figure out, do I cover the cost of my diabetes medication or do I pay my rent?
Right.
And so there's an element of trust that we have to build in our communities to overcome some of that. And so through our partnership with Salvation Army, we were able to utilize community health workers that actually are of the community. Some reside in the community, some are very connected to the community. And our goal was to employ in our community. Right? We wanted to make sure that who we had out in the community, helping our community to navigate through the complex health system, actually they were of the community. And that's how we're building trust. It is through our partnership with Salvation Army, where we're able to say, you know what, we want to remove those health disparities where we can. We don't want you to have to decide, do I pay my high blood pressure medication or my diabetes medication, or do I pay my rent? And that partnership is how we're able to help build that bridge. And we're hopeful that with those types of community engagements, we can then begin to establish an element of trust. And that is so important, especially now. And so we have loved our community partnership with Salvation Army. For those of you that don't know, back during the unrest of Michael Brown in Ferguson, there was a Quick Trip that burned down. And the Quick Trip donated that land to the community. And out of that came a partnership with the Urban League and Salvation Army. They rebuilt a community empowerment center right there where that Quick Trip was. And that's where our partnership with Salvation Army happens. That's where our community health workers are, right there in the heart of the community, working with those high-risk zip codes and populations. So it's just a little step, but at least it helps us to start to build those bridges and fill in those gaps surrounding those health disparities.
Yeah. And some of the conversations that you and I had earlier today, and even in our discussion tonight, I'm wondering how people find out about these great resources, right? What are you all doing to maybe canvas the Black and Brown communities to really start talking about these resources are available? Because even as a young man who's not in that particular area, I still am kind of at a loss for what resources are out there, how I can help others in my community seek out the help they need, right? So what are you all doing to really kind of canvas in these Black and brown communities to say, hey, we're here and we're here to help?
So we do a lot of community outreach. For example, on Saturday, we have a social distance mammogram van that will be at the Ferguson Community Empowerment Center. We're trying to take our resources to the community. You know, in healthcare, we've had a history of waiting for people to come to us.
Education too.
Educate them, right? And so we've quickly realized that we can't do that. We have to take this information to them.
Right.
We have to figure out how to meet our patients, how to meet our community where they live, work, and play. And so that's what we're trying to do right now, is really trying to focus on how do we do that community engagement and outreach.
Yeah. And I'm in education, and we are now beginning to do that work. We have done a poor job that our parents should be the one to come into the school buildings when something goes wrong with their student, not realizing that sometimes parents are working two jobs, or parents are working at night, so they're sleeping during the day, right? And so going to the community to share these resources is vitally important. I'm glad that you mentioned that. Speaking of resources, I'm thinking also about the knowledge that you're sharing tonight. There's a lack of knowledge about this virus just altogether. We're just hearing that put your mask on and stay away from people. And it's just affecting, the Black community more than it's affecting others. But when something happened that affects individuals who are usually healthy or who are not familiar with the healthcare system, they show up in the hospital or in emergency care, right? They're normally healthy, and they're not quite sure how the system works. So I'm just going to go to the ER. Emergent issues versus non-emergent issues is something we're not necessarily knowledgeable about. So where can we find resources on how to understand how to navigate just the healthcare system?
And we're trying to do that here in our community. We have some reputable medical directors that are African American that actually have health systems here or health clinics here locally. And I think oftentimes people seek emergent care because they don't feel like they have any other options. Right? So there's always the perception that people come to the emergency room because it's quick, fast, and easy. What we're finding is people are coming when they're really, really sick, when it's a last resort, when they don't have health care and they don't have health access. And so what we're trying to do is reach out into the community, share the difference between what's an emergent visit to the hospital versus non-emergent. And we're trying to link those individuals to the resources that they need. It would be wonderful if we could expand Medicaid here in Missouri. And it's, as we talked about on Tuesday, it is on the ballot. Here in August 4th. And we at Christian are doing everything that we can to get the word out, because Medicaid expansion will make such a difference in the lives of our community. We will be able to start navigating patients more aggressively to quality health care, getting them what they need in terms of coverage. And so Medicaid expansion hasn't happened here in Missouri, and we are certainly hopeful that it will happen this August.
Mm-hmm. Yeah, and we remain hopeful in the rest of the nation as well. One of the questions in the chat earlier was, while we can social distance, what other things, I guess, is your organization teaching about just the virus itself? Again, lack of knowledge. We just don't know all that it can do until it's too late.
Sure.
Right? And so what are some of the other things that you have begun educating the community about how to be proactive. Yeah, we hear doctors say wash your hands and wear masks, but there's got to be some other things that we can lock into our daily routine and become very habitual about.
Mm-hmm. We have been having community leaders breakfasts where we have our medical directors, we've had our infectious disease docs to give us information. We've had our primary care physicians actually at those breakfasts virtually, where they are educating our community. And it isn't just community leaders, we also open it up to our community more broadly. But the goal is to have these virtual talks as often as possible so that we can continue, to your point, to educate. You know, if we understand the why, we may be a little more engaged and apt to comply. But we have to understand the why. And so we have been working really diligently with our teams here to try to educate the community. And I must say, our health centers and our St. Louis regional task force has also done a phenomenal job. Dr. Jason Purnell with Washington University and others have partnered to try to get into these community, and we have yard signs and we have flyers and we're giving out masks. We have food drives. So the Urban League here in St. Louis has really stepped up to have food drives in these high risk areas. And in addition to that, they're trying to hand out masks and what have you. And it goes back to meeting our community where they live, work, and play. I think that's key is getting the word out that way. Yeah.
Really have appreciate just your insight, Dana, into all of this. Want to have you back on again. I do want to talk my last question just about health disparities. Like we've talked about COVID-19, but getting to the root, getting to the cause of why these numbers affect the Black community in so many different ways. You mentioned earlier health disparities, housing, transportation, jobs. And so if that is the root, is your organization and Salvation Army and other community organizations assisting the Black community in overcoming some of these disparities?
Yeah. So, and to your point, I also think we desperately need policy change, to address those health disparities. As we talked about earlier, when it comes to inequities, there are health inequities, there are inequities in employment, there are inequities in our justice system. They're all linked together. And once we start to see that policy change, once we start to rally around making a change in how we interact with others and how we interact with the political system, I think we'll start to see some real impact in our health disparities, such as transportation, mental health, substance abuse, financial resource strain. There are a plethora of health disparities that I think we'll be able to tackle. And I'm optimistic because I feel like these inequities are connected, and I am empowered by the fact that we are starting to come together and raise our voices in various circles when it comes to these inequities that we're facing, and it all links together. And so I'm really hopeful that we're going to hopefully make some changes this come August and November.
Yeah, policy is important, and I remain optimistic with you as well. I didn't experience it in my lifetime, but when the bus boycott in the 60s, I'm told 381 days, African Americans just refused to ride public transportation. Right? It's going to take something that extreme in order to really bring about some of this change that we're talking about through policies and some of the health disparities. In your opinion, and again, I know you don't have a crystal ball, but do you feel and believe that this nation, and not just Black and brown, but whites and Asians and Hispanics as well, the entire nation is at a place now where they're so tired of seeing all of these racial injustices that the nation is willing to come together and demand that these health disparities be mitigated through policy and mitigated through actionable organizational change and culture. Do you see that on the horizon?
You know, that's a very good question, and I'm hopeful.
Yeah.
I can say that on Memorial Day, that week, when we experienced what we did with the public lynching of Mr. Floyd, COVID stopped. We know COVID didn't stop, but people raised up and they took a risk because people are tired.
Yeah.
You know, and I spoke with one of my my white colleagues, and she said, you know, we're in the middle of a pandemic, and this is such a dangerous time. And, you know, we talked about how we've been fighting and fighting and fighting for so long. I mean, going back to Rodney King, that was 30 years ago. And we're still seeing these videos, and people are really exhausted, and just to see the international outpour, which is nothing that I've ever seen in my lifetime, that spoke volumes to me personally, in that, you know, this became an international outpour of injustice. And so I am certainly hopeful that we'll be able to get through this, and that we'll be able to get to a place where we're making true changes. But I don't have a crystal ball, and, you know, I don't know what our future holds, but I certainly hope at least in November we'll be able to have some kind of change.